reports, and I will invite members to make contributions.
Yeah.
Okay, do you want to start the recording, please, Fiona? Or Diane?
I've started it.
Right, that's great. You've started it.
Yes.
Okay, welcome everyone to this meeting of East Lothian IJB on the 10th of December 2020, which is being held remotely in accordance with the Scottish Government's recommendations as regards physical distancing during the COVID-19 outbreak. This meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention, and the webcast of this meeting will be publicly available for up to 6 months. First item, please, Fiona.
I'll cover, first of all, apologies. We haven't received any apologies that I'm aware of, unless any have been submitted to you.
I haven't received any.
Okay, that's fine, thank you. I'll now do a roll call of attendees. I'll do voting members, then non-voting members, and I'll also cover officers as well. First of all, the voting members. When you hear your name, if you could respond, please. Shamin Akhtar. Neil Gilbert. Susan Kempson.
Present.
Thank you. Fiona O'Donnell.
Present.
Patricia Donald.
Present.
Fiona Ireland.
Present.
Peter Murray.
Present.
Richard Williams. No. Okay. And non-voting members, David Binney. David, are you there?
Yep, I'm here.
Thank you. Gurab Chowdhury. Philip Connellan. Lorraine Cowan. Richard Fairclough. Claire Flanagan.
Present.
Thank you, Claire. Ian Gorman.
Present.
Thank you. Alison MacDonald.
Present.
Marilyn McNeil. Thomas Miller.
Present.
Thank you. John Turville.
Present.
Leslie White. Paul White.
Present.
Thank you. And I notice we've now got Neil Gilbert.
Yeah, managed to log in. I'm here.
Well done, Neil.
And now I'll just confirm I have Paul Curry present and Laura Kerr. Is that right?
Yeah, present.
Are there any other officers who I haven't included?
Leslie Berry.
Leslie Berry, thank you.
And Judith.
Sorry?
Judith Tate.
Oh, Judith, thank you.
And Claire Goodwin.
Thank you. And Claire. That's great. Thank you. I think we've got everyone now. Can I invite members to indicate if they have a declaration of interest to make on any item, please?
No.
I will declare an interest in relation to item 7.
Item 7. Thank you, David.
Fiona, could I just say Marilyn McNeil has joined us.
Marilyn has just joined us. Thanks, Paul.
Hi, Fiona.
Hi, thank you, Marilyn.
Thank you.
I'll just confirm, David, that item 7, you will be required to leave the meeting before we consider the report, but I'll give you a reminder before that item starts. So if you can log off at that point, it would be great. Thank you. Before I go to item 1, just to say there's a change in the agenda order. The report at item 6, the financial update, will be taken after the chair's report, as Claire has another meeting to attend. So we're ready to proceed with the agenda, Chair, if you're happy.
Thank you, Fiona. And can I just remind members to mute their microphones, please, if they're not speaking? Thank you for that. So the first item is the minutes of 29th of October for approval. Are there any matters of accuracy for the minutes? If you could indicate by raising your hand, please. Okay, are members happy to approve those?
Yes.
Thank you very much for that. The next item is any matters arising from the minutes. Are there any matters arising? Paul White.
I've got one that last time we talked about a response to the review of adult social care. And I'm wondering, was that response circulated to all IJB members?
Can I ask you, and I certainly know that I saw it, was it sent to non-voting members as well?
Yes, I circulated it to non-voting, all members, voting and non-voting, after it had been submitted to the Scottish Government, but I can do that again.
Okay, and could you, thank you, Claire. Paul, could you check that Paul is included, and if there's anyone else who didn't receive a copy, could you get in touch with Claire, please? I'm sorry, Paul, if you didn't receive it, and thank you for circulating the LCAP submission. I had one matter arising, which was just to say that the report, the part of the minute which covers sustainability payments, that at Audit and Risk this week, we had an audit report which was extremely complimentary about the way that's been managed by officers. So just to update that we've had a clear bill of health and that, no recommendations from audit, and thank all the officers involved. Okay, and I don't see any other hands up, so we'll move on to the next item, please, Fiona.
Thank you. The next item is the Chair's report.
Thank you for that. I wanted to thank all members for their contributions to the submission from the IJB to the Adult Social Care Review, and also the First Responder Review, and thank you in particular Claire for managing to pull all that together. I think it was a really good response. This will be the last meeting of 2020, so I just want to place on record on behalf of the IJB, I'm sure, our thanks to all health and social care workers who have done such an incredible job this year in response to the pandemic and ensuring that they keep people living in East Lothian safe and as well as possible. And the next challenge has now begun. Thank you, Alison, for sharing on social media at the beginning of the rollout of the COVID-19 vaccine. And I know there's been a huge amount of planning, which has been, placed considerable strain on officers in preparing for that, and that will not begin and end this week, or I suspect this year. So just a huge thank you to all the team involved in that, and also to our partners in the independent and the third sector for your contributions as well. We'll be eternally grateful for everything you've done at such a difficult time. Next item, Fiona, then, please.
Thank you. It's item 6, which is the financial update for 2020-21, and it's Claire Flanagan to present.
Thank you, Fiona. Thank you, Chair. This finance update provides the board with the IJB's most recent year-to-date position and the outputs from their recent quarterly financial forecast carried out by our partners, East Lothian Council and NHS Lothian. So this forecast was undertaken at month 6, so that's end of September 2020. As reported in October, the financial position is not straightforward to report, and the finance teams in both partners' finance departments continue their work to determine the financial position in terms of the core operational activity, the impact that COVID-19 costs have had on the position, and more recently the remobilisation of some of our services and the extent to which these costs will be covered by funding from Scottish Government. The situation is a dynamic one, so things are constantly changing. The East Lothian IJB year-to-date position at the end of September was an overspend of £2.2 million. Forecasted year-end positions as a result of the most recent financial projections is an overspend of £4.7 million across the IJB's all of its delegated functions. Similar to last month's update, you'll see highlighted in Table 1 that of the year-to-date position, if you strip out the COVID-related costs, then the IJB's year-to-date position would significantly improve, highlighting an element of financial offsets in our system. The forecast of £4.7 million overspent is broken down within Table 2. The COVID cost projections change as new developments occur, and the most recent financial return submission into Scottish Government, we were reporting a projection of £8 million for the Health and Social Care Partnership for this financial year. In terms of this is the extent to which COVID costs have impacted on our Health and Social Care Partnership. The Health and Social Care Partnership has now received Scottish Government funding of £4.7 million, and paragraph 3.6 provides detail on the tranches of funding we have received. Unfortunately, at the time of writing this report and reporting on the end of September position, only a small element of this funding had been included. During November, further funding has been released into the Health and Social Care Partnership's financial position, so we should see an improving position in future months. It is worth noting that the above funding from Scottish Government excludes funding for prescribing overspend, which is all COVID related, and for our FHS or GMS related COVID related costs. You'll be aware that all our GP practices worked the bank holiday back in Easter, and therefore had an additional payment for this. So this is the funding that we're still waiting to come in to cover these types of costs. I'm pleased to say recently we now have actually received the allocation for the FHS or the GMS element. This came in via NHS Lothian, and it totalled £3.1 million. And we're just working with the 4 health and social care partnerships across Lothian to understand the split of that for each of our individual components. The position will continue to be monitored to better understand all the different elements impacting this, and I'm hopeful that the next finance report we will have the COVID funding included, which will improve the position. Given the funding from Scottish Government has started to flow through the system, and we are aware now of future potential financial allocations in January and potentially again in March, the financial risk has significantly reduced. We are now also looking at the impact COVID has had on the longer term, so future financial years financial positions, and we are working to ensure we are coordinated with all the different financial help networks to help support this work of analysis in the future years that the impact of COVID and service remobilisation will have. Very finally, in paragraph 310 in the report just highlights the Scottish Government budget announcement arrangements for 21-22 and the challenges this brings for setting the IJB budget next year. And it's just to assure that myself, Alison and Ian continue to work with both partners on this to ensure we have early dialogue, even though we don't have confirmed values.
Thank you very much, Claire. And while others have a chance to raise their hands, thank you for the report. So in summary then, the shortfall at this stage in terms of COVID related spend, where does that sit, please? I don't have a calculator to take away from the 8 million and what we've received.
So in terms of our 8 million projection, we've received we'll probably received closer to, with the FHS allocation in, I think that's probably going to take us up closer to 5 million of funding. So we've still got a gap of approximately 3 million. But you'll be aware that the projections for COVID related costs, the 8 million, it changes all the time. And I think there's actually an example in the paper whereby that was our submission in October, and we know things have moved on since then. So our next submission to Scottish Government in January will include further interventions that we've had to put in place.
Right, and Council, the draft budget goes to Cabinet in January, so that will will give an indication. And when do you expect to hear, in terms of 21-22, if there's going to be a commitment for covering the COVID-related spend beyond this year's budget?
We've not had that assurance as yet. All we can say is that we're aware that Scottish Government are looking to try and do a piece of work to understand the impact this will have on future financial years. So they're looking at collating some financial information for the next I think it's 4 or 5 years across the whole of the system, and we'll tap into that and then have a better understanding at that stage once that's collated.
Yeah, and it's reassuring to hear that you and colleagues are looking at the 5-year projection for spending, and particularly I think you in terms of prescribing budget, that what that's going to mean if we're going to have an annual rollout of the COVID-19 budget. Do you have any idea when you might be able to present a revised 5-year plan?
Not right at this moment in time. I think because we're in the mix of the second wave and we don't exactly know what the impact the vaccine will have, it's really difficult to have anything concrete enough to do a refinement as yet.
Absolutely understand that. Thank you, Claire. Tricia and then Peter, please.
Thank you, Claire. It's really hard for the rest of us to grasp the complexity of what you've been doing. So I really commend your ability to juggle and balance the books. And I suppose my question is, at the end of the year, you draw a line, but it will be very hard in this sort of fluid situation to know whether we have an overspend or an underspend in certain budget lines. So will there be some flexibility so that if people are holding back just in case, that they can actually then spend beyond the end of the year?
I think that really depends on where the financial position lands itself at the 31st of March. In terms of our earmarked recurring allocation, so we do have an earmarked reserve as part of the IJB. Anything that forms part of that will be carried forward into future financial years for those commitments that was intended against. Where there's just core operational overspends, we really need to assess that right at that assessment tends to come closer into February and then March.
Do you want to have a follow-up question, Tricia?
No, I'll leave it in her capable hands.
Okay. Peter.
Thanks, Fiona. A couple of questions if I can. The increase in spending, if I've read it right, in prescribing, Claire, I'm slightly puzzled by that. Why has that resulted, or maybe Alison more appropriately, why has that resulted in such a significant overspend? That's my first question. Will I carry on, Fiona?
Yes, carry on, in case Alison needs to come, or Claire, and that will let Claire as well leave as soon as she can. Thank you.
The overspend in set aside, I'm trying to fathom out why that would be a significant overspend when activity in normal hospital actions have obviously reduced. So I suppose I'm keen to try to understand that a bit more. And there was one other I had, which was, let me just find the table. Unmet savings. Were the unmet savings out of actions that we simply had to expand in because we had anticipated some ability to reduce the spend in those areas, but they were COVID related, or is that unconnected to the COVID aspects of the budget?
Okay, I will take, so in terms of prescribing, the significant, so when NHS Lothian done their financial plan for the prescribing budget at the start of the financial year, there was a significant gap, about 2.4 million. In terms of the budget offer that came in from NHS Lothian, we got a 3% uplift on our recurring budget from NHS Lothian, and across the four partnerships, we took the decision to top up the prescribing budget. So each of the four partnerships topped up the prescribing budget, which put it back into balance. So when, at the start of the financial year, the prescribing budget, everything being as normal, the prescribing budget should have been sufficient for the anticipated spend within those areas. The fact that the prescribing budget now is overspent, given it was balanced at the start of the financial year, you can see the elements where the assumption is that the impact that has had an impact from COVID, and the main areas are let me just get the file up because I'm not going to be able to pronounce this properly. There's been a short supply in one of our drugs, which has put the price up, and whereby we've not really seen a massive impact in terms of volumes. The price has risen on a number of specific drugs. Sorry, I'm just trying to find the name of that.
Might be interesting while you're looking for that, Claire, to understand if we think that Brexit's going to have an impact. I think you're muted now, Claire.
Sorry. So the drug that's been in short supply is sertraline. Right. So that's had a massive impact in terms of the prescribing budget. That's over £1.3 million. And then we've got some other drugs such as apixaban that's another £1 million of a cost increase for the prices increased.
So is that opportunism of the supply?
No, I actually think I should have really have. Oh, I don't want to say it. I don't want to say anything that's wrong about these drugs.
Can I come in there, Chair?
Put something in the chat about this, so maybe John can jump in with something about the.
Okay, and Ian's wanting to come in as well, so we'll take John first and then Ian.
I'm just passing on in the chat the text of an email from Alan Malavi, our lead pharmacist, commenting on those two areas that Claire just outlined. Apixaban is an alternative drug to warfarin, and that the prescribing of that's been on an upward trend. Reasons for that include a desire warfarin requires blood monitoring, so shifting people onto apixaban that doesn't require blood monitoring is a safety move to keep people from having to attend health centres for blood tests. And our activity in East Lothian on that has been higher than in other areas, and the sertraline is a jump in the cost, and it's around tenfold. The price is coming back down again, he says, but drugs can sometimes do this. I don't know what's behind that, I'm afraid, but it does help to explain some of the pressures.
Thank you, John.
Okay, Ian, do you want to come in as well on this?
Thank you. It was just that I was speaking to Alan about this today, so I haven't had a chance to update Claire yet, but one of the reasons for the increase in apixaban use, and it's been across the board actually, not just in East Lothian, although we were at the front of this, as John says, was to prevent footfall in practices. So it was pushed heavily at the start of COVID. So I've asked Alan just to do an analysis of what our use was pre and during COVID to see if that's been a direct effect for us. Might not have been though, because as I understand, when it was originally suggested, East Lothian most of the practices were early adopters of it at the beginning, but I have asked for that comparison because it may be that COVID's had another impact on that, so we can potentially factor that into some of the mitigation costs that we have for COVID. And for sertraline, I think it was primarily just down to availability. I think there was a particular dosage that was not available for a while, so others had to be used, other suppliers had to be used, and that's what drives up the cost. And the supplies are now available again. But as John says, it's a really common occurrence for prescribing to have particular drugs. Normally, we look for, if it's going to be a longer term issue, we look for alternatives, and sometimes the alternatives mean they're much more expensive. In this case, we were never at a stage where there was zero stock. It's just the price of the stock went up.
And can I ask as well, I don't know, John, if before I bring Richard in terms of drugs like sertraline, which I understand are reviewed, has the impact of COVID on primary care meant that you're less able to review medication? So, someone who was maybe going to stop taking a medication like sertraline, that might be delayed?
Well, sertraline is one of the SSRI antidepressants, sort of sister drug to fluoxetine, or what was Prozac. And certainly reviewing medication has been increasingly challenging, and particularly antidepressants is something that practices would like to have the time to do more of, because if people have been taking these drugs for some time for a depressive illness or an anxiety disorder, you do want to review their progress and how they're getting on, and whether they want to consider reducing and stopping, or whether it's appropriate to continue longer term. And I think it certainly, from my experience in the later stages of the pandemic, it's quite difficult to find time in the day to phone patients and discuss these things with them when they're seeking a reauthorization of their prescription.
Thank you, John. I appreciate that honest and full response. Richard, you wanted to come in.
Thank you, Fiona, and also apologies for being slightly late during the meeting. Obviously, prescribing is very interesting, and it is one of the commonest causes of adverse events. So it's something we need to keep a close eye on. I'm sure GPs and their pharmacy colleagues do that. I mean, apixaban particularly, there are a number of Lothian-wide protocols and indications for apixaban. So, can we be assured that East Lothian GPs are adhering to those guidelines? I mean, is the increase out of proportion to what other areas are doing because East Lothian GPs are not following the guidelines? Or is it that they are appropriately prescribing apixaban? Because whilst the reduction in warfarin monitoring is helpful, it's not a panacea for all indications.
Who would like to respond to that? John, are you able to, please?
I'll try. It's a very good question, and the choice between warfarin and apixaban is a finely judged one, Richard, as you'll know, and I think the balance of that judgment has been shifted slightly towards apixaban, and there are pros and cons to that. Obviously, cost is a con. The lack of need for regular monitoring is a pro, and it was the desire, as we've said already, to reduce the need for people to come into health centres and run the risk of contracting COVID that pushed some of this. I'm certain that, however, that guidance and protocols are being followed, and members should be reassured of that.
Okay, can I bring in Ian and then Alison, and then I'll come back to you, Richard, to see if you have any follow-up. Thank you.
Thanks, Fiona. I was just going to reiterate that I wouldn't have a yes or no answer to Richard's question right now, but it is, again, something that with Alan doing the review on this, it's worth benchmarking against the other areas to understand the difference. And in the recent months, we have secured additional support for prescribing review to tackle some of the issue of the high costs we have in prescribing. So the new member of staff has joined the prescribing team. So it's another area where we can add enhanced scrutiny on this. And one of the reasons for doing it is because of the additional financial pressures within prescribing and recognition that I think at the moment there's a bit of a question mark over the impact of Brexit. So because of the potential risks to pharmacy, it's another reason why we felt it necessary to enhance the team. So as I say, unfortunately, we don't have an answer to that right now, but I think it's a good question and one we'll look into.
Okay. And we had a report yesterday at the Health Board, in the appointment across each of the IJB areas of a lead pharmacist, and I understand that's progressing in East Lothian, and presumably that will also assist in terms of oversight of prescribing budgets. Alison.
I was probably just going to add that bit that Ian added at the end there, that we have recognised that our prescribing budget is somewhere that we really need to do some real concentration, and the work that the pharmacy team have done in primary care over the last couple of years, expanding the pharmacotherapy into practices to support practices, has possibly not had that focus on this side of the prescribing budget that we should have. So we have recognised that, and hence we've recruited somebody 20 hours a week who will specifically be looking at this, because I think it's such a volatile market that can put things up out of kilter very quickly.
Thank you, Alison. Richard, do you have any follow-up on that?
Just obviously to thank people for their comments. That was very helpful. And prescribing clearly is a big issue for us, both in terms of cost, but also safety. And I'm pleased to hear that it's going to have an increased focus as we go forward. So that's great. Thank you.
Thank you. Peter, have all your questions been answered? Sorry, I've lost track.
That was only the first one. I'm loath to ask the other two.
Do you want to just repeat?
Yeah, they're probably simpler, I suspect. One was on the unmet savings, and the other was on set aside. So the set aside question is on the same basis as the prescribing, that I would have expected it not to have seen an increase, but clearly there has been an increase. I'm just puzzled as to why.
Right. I'm aware that I've got Paul and David both wanting to come in. Can I just check if that's in relation to the prescribing budget before we move on to Peter's next two questions? Paul, was your question about prescribing budget?
No, prescribing. No, too technical for me, Chair.
Right, okay, you're far too humble. And can I just check, David, was it in relation to the prescribing budget or another item?
There was another item.
Great, thank you very much. Okay then, Paul, I think you're wanting to respond to, hopefully, to Peter's following questions.
No, mine wasn't related to Peter's questions. It might make sense for those to be addressed first, and then I can.
Sorry, I meant Paul Curry. I should have been clearer. I'm not going to ask you to comment on the set aside budget. So, Paul Curry, would you like to respond, please?
Which question am I responding to, Fiona? Sorry.
Apologies, I thought your hand was up. Okay, in terms of Claire, are you able to respond to the questions from Peter Murray?
Yes, I'll quickly respond to the other two questions if nobody else wants to give my response for me. So in terms of the set aside budget, Peter, our set aside budget's always been overspent, and one of the biggest financial pressures we've got in our set aside budget is actually junior doctors. So the junior doctor staffing budget. It's not unique to East Lothian. It's across NHS Lothian in totality. There's a massive financial pressure in the junior doctors budget. So that hasn't went away during the pandemic. That's still there, just as a core kind of operational overspend. In terms of our unmet savings, the reason that's in our LMP return is, you know, we did have some savings plans at the start of the year, but our savings performance and our savings plans really rely heavily on officers within the partnership to drive this forward with support from the finance team. And just given the fact that these officers were the frontline staff in terms of responding to the pandemic, we didn't push around delivering of financial savings really for the first kind of 9 months of this financial year. We've really let the officers focus on where we thought we were getting a bit of a gap after the first wave, the fact that the second wave is now hit and that we've got the vaccine starting. We've not pushed officers to deliver any of these savings.
Thank you, Claire. I think as well, redesign of services has slowed. So you're on mute again, Claire.
If I could just make a quick comment back, just to finish off.
Right, Claire, have you finished? I could see your lips moving, but I couldn't hear anything.
I've finished my response unless Peter's got another question.
Okay, Peter, you had a follow up?
I don't know if you're seeing it, Fiona, but I think there's a delay on Claire's speech and what you're seeing in the picture, that might be the confusion. Just the follow up on the junior doctors. I remember raising this at the NHS board about 4 years ago, so it's interesting to see as an impact. So maybe in time when we've got more ability to focus on this, we can return to that. Yeah,
or there needs to be a reprofiling of the budget if it's an ongoing overspend. Okay, thank you very much for that, Peter, and for officers who responded. Can I bring in David Binney now, please, and then Paul White?
Thank you. It's a bit of clarification for my education. Is the Scottish Government, we've got this sort of lag between what the Scottish Government are refunding to us. Is the Scottish Government giving a commitment to refund all COVID costs, or are they giving a commitment to refund all reasonable costs, and they will define what's reasonable? Therefore, there's a possibility that we will have a shortfall in the claims that we make. And if that is the case, what's the sort of contingency or a sort of mitigation that we would do to try and accommodate that before the year end when it all crystallises?
A very good, if slightly worrying contribution. Thank you, David. Alison, do you want to respond to that, please?
Maybe the first part, and Claire maybe wants to add to it. I think we have been very clear from the start in our governance process about spend for the IJB and the partnership. So we have put in very succinct mobilisation plans from the beginning of the pandemic, which has itemised cost very clearly, and we've changed that as costs either haven't transpired or have gone up or down. You know, some have gone up as well, but most of them have gone down. You maybe have not been able to recruit people at a certain point in time. So it's been a very dynamic document and funding stream that Claire's been managing with the help of officers. And I think we've never put one of them in that hasn't gone through a process where it's gone perhaps either to the council or to NHS Lothian. And what we're doing, we are doing things that have been guaranteed to be covered by our partners if things didn't transpire. And if I give an example of some of the actions we took for delayed discharge, that was covered by NHS Lothian. So we got a kind of guarantee that we could go ahead, we could do things, and that our partners would support us with that. So we've always had backup of our partners to be doing. It would obviously cause them issues if we didn't then get the funding following through, but everything's gone through a process that has allowed us to have the confidence that our partners were supporting us with us.
And in terms of Alison, that we've had a commitment then that all approved as long as we're meeting that threshold with our partners, and that will all then be right. Thank you.
And the other thing possibly to add is that we've been very clear when we've been working our way, for example, through the sustainability payments. Now that's nearly £1 million we've paid out. So the fact that we've paid that money out, we have done that to the exact principles that were set down by the Scottish Government. So we haven't deviated, and we've kept very clear records so that there really isn't any reason not to give us the money.
Thank you very much, and it was good that those systems were in place. Claire had them in place right at the start, and having that decision log as well, that you were able to track that backwards. David, are you happy with that response?
Yes, very interested in it, and congratulations on being up with the front of the wave.
Great, thank you very much. Okay, Paul White.
It's kind of related to David's question, and Alison's response was helpful, but if I'm remembering the figures right, we've still got a gap of around £3 million between what we've spent on COVID-related costs and what the Scottish Government has committed to us thus far. So are we confident that that additional £3 million will come our way? And if we aren't, will there be an impact on services?
I think probably I would let Claire answer that. I'm confident because I just have to be. I think we've done this in a wing and a prayer, some of it, but we are confident. But I'll let Claire answer that.
Yeah, so the 8 million is actually our cost projection for the full of this financial year, albeit maybe not all of those costs have actually been incurred to date, but we are projecting they will materialise. And in terms of the funding that we have received, it's now starting to come through more routinely. There was a bit of a gap in terms of the first part of the financial year, but we're linking in with Scottish Government, and we know there'll be another there's another financial allocation due out in January. We know that the allocations are based on what the financial returns that we submit to them. So what we do is we give them our financial return as to where our projections are. They look at what funding we've had to date, and then they calculate a funding, like an allocation balance for us. So I think it will. I think the funding will flow. I think the bit that we probably have to do locally is look to see where we maybe have any sort of financial offsets. So, for example, we will have a travel budget in the partnership that probably we haven't spent any sort of expenditure against. So that's a piece of work we're now taking forward, whereby trying to understand the additional COVID-related costs, but actually, do we have any financial offsets as a result of COVID as well?
Thank you, that's really helpful, much appreciated.
Thank you. I think the big ticket items like the ward at the community hospital that that we have sign off and an agreement that that's reasonable before those decisions are taken. Are there any other questions for Claire? Alison, is your hand up from a previous? Thank you, Alison. Okay, thank you very much, Claire, for that report. Fiona, can you just remind me? I think we just need to note within this item. Is that correct?
Yes, that's correct. Do you want to go over the recommendations?
Yes, please. That would be helpful.
The IJB is being asked to note the financial forecast provided by our partners, to note that additional COVID-19 funding was confirmed during November, and although not included in these reported month 6 positions, will start to be allocated to the partners to cover backdated costs. Also note that ongoing certainties of COVID-19 and the remobilisation of services for both partners and the financial impact. And finally, to note that the Scottish Government budget timetable for 2021-22 and the consequences for both partners. And if I could ask members to indicate whether they're happy to note.
Agreed.
Yes, happy to note.
Agreed. Thank you.
Thank you very much. And thank you, Claire. And we'll let you depart to Mid Lothian. And I hope you have a lovely time over the festive period. Take care.
Thank you. Thank you.
Okay, next item, Fiona.
The next item
Please.
Is item 4 on the agenda, which is improving and maintaining delayed discharge performance through winter.
And which officer is going to speak to that, please?
I believe it's Paul Curry.
Okay, Paul.
Hello, everybody. My machine's having a bit of problems, but hopefully you can all hear me. Excellent. The short paper in front of you is bringing to the attention of the IJB members Scottish Government expectation focused on not just improving but maintaining delayed discharge performance through winter. And that, of course, is driven by the fact that we need to try and maintain movement of patients through the acute sector in order to maintain availability of beds should there be extra demands placed on them by COVID and by the effects of winter and flu and such like. So it's not a long paper, but it gives you a bit of background and recognises the fact that the East Lothian Partnership has done pretty well in its delayed discharge performance over recent years. It did very well indeed during the April period, and that in fact is the part of the performance that the Scottish Government is asking all HSCPs to focus on to try and bring performance back to April levels. What Alison can maybe clarify for us at the end of this is whether we've yet received a figure, because at the point of writing this paper, the expectation of meeting April performance was there. Figure from paper gives you some description of the variation in performance through the April month and how we were at the point of writing this paper. The background also tells you a bit more about the context of this requirement, including the expectations within the Adult Social Care Winter Preparedness Plan, for which a footnote will give you a link to the actual paper. And that sets out a range of actions that partners, including ourselves and the HSCP, have to deliver to support adult social care through the winter. And another paper that is being spoken about shortly says a bit more about some of the things that are already in place in the partnership and some of the good work that our colleagues have done in the operational side to coordinate delivery of services to improve outcomes for patients. We reflect on the low, as in good performance in April, which went down to 3 delayed discharges but averaged at 7, and that has gone up and down a wee bit over the following months, but has still maintained performance amongst the best across Scotland, I believe. The paper also reflects on how a range of other partners work, such as through the GP services, and such have managed to direct activity away from praxis to a range of new services, and that also helps in terms of identifying people with need and responding to their needs. We also have a very effective care home team that supported the care homes in preventing inappropriate admissions. And of course, in the light of COVID, if you are admitted to a hospital as somebody with health problems who's also very old, that does bring increased clinical risk. The rest of the paper just says a bit more about the work we're doing to coordinate services through hospital at home, rehabilitation, hospital to home, and the way in which we're using Lothian Winter Plan monies to scale up our services to meet demand and to, I think, prove to be quite fleet of foot in terms of how our teams are able to develop its services to maintain movement of patients. There's nothing specific to say in terms of engagement or policy integration impacts. There's no requirement, I think, for new directions to deliver this set of changes and improvements because our team's already delivering that under existing arrangements. And under financial, it notes that Winter Plan and other investment is around to help with this set of new requirements. And it notes that there is investment in place already in terms of the staffing that's been required to respond to recent changes. So in closing, I'd say we're looking for the IJB to support the work across the partnership to deliver and to maintain the as yet to be agreed level of delayed discharge performance through winter. Thank you.
Thank you, Paul. And that sustained record of performance in this area has not only helped to ease the capacity, some of the capacity issues in acute, but it's also kept our residents in our care homes safe, as Alison has said in the past. I just wanted to ask, in terms of people not waiting for discharge from hospital, but people who've been discharged to care homes and are waiting for a care package to return to the community, is that a significant pressure? Are we sort of monitoring that in East Lothian just now, please?
We're certainly monitoring it, Fiona, and there's very few. It's not something that we do on a regular basis, and it's not something we've required to do. I think we're lucky and we've got the capacity in the community hospital, so we tend to bring people back to East Lothian and then we work with them out from the community hospital. We don't tend to have to ask people to go to care homes. Like, occasionally it happens because there might be, it might be closer to family. They may be waiting for something that's incredibly complex, but it's always done on an individual basis, and we work with the resident and their families. And I should mention at this point, if there's a cost. If there's a difference in cost, if somebody's waiting somewhere, then we meet that cost for that resident. So we are very specific about that. It's not done on a normal basis.
Thank you, Alison, and thank you to you, in particular to Lorraine Cowan, for all the continued efforts in this area. And just say been in touch about a case of someone who was waiting to be discharged. I was hugely impressed by the lengths to which social work, in sourcing the package of care, which so it was just great to see how far they were willing to go to make sure that person could return home. I have a number of people now waiting with their hands up. If I start with you, please, Sue Kempson. Thank you.
I just have to unmute. I'd like to congratulate everybody on their success and their hard work. The only thing that concerns me with relating to the numbers relating to April is that there may have been less people in hospital at the time, and I think these figures really only make sense when it's against the number of sort of, if you like, elderly or those particular people who may need help are actually present in hospital, because in April we were right at the start of the pandemic and people weren't actually going into hospital. So this may be a number that's rather unfair, if I'm making myself clear.
Yeah, I think that's a fair comment, except when you look at other IJB areas, Sue, and it doesn't explain the divergence, I think, between the performance in East Lothian and others, but then there are particular challenges in each area. Does anyone want to make a comment or a response to Sue, please?
Just to say, I will, Sue, just to say that unofficially, we've always tried to keep ourselves in single figures. That's our unofficial aim. So, it goes up and down. You can have you can have a case conference at the Royal Infirmary and we may get 5 or 6 people added on in a day, which would take us from 6 to 11. But unofficially, we like to keep ourselves under 10. We like the single figures.
Yes. Oh, yes. I congratulate you all on your great efforts on this. But I just wondered whether using it against April was in fact an unfair measure. It's.
I don't think so for us. I think we would like to keep it at that. I think that we wouldn't go any lower. I'll tell you that.
Yes.
Paul, did you want to make an additional comment?
Yes, I was going to say that part of the reason that April was so successful was because of the phenomenal efforts of our clinical and operational colleagues in getting behind, bringing the numbers down and keeping them down. So, they do, I think they've been given recognition for that.
Thank you. Richard and then Tricia. Richard, please.
Thank you, Fiona. Again, I want to congratulate everyone. I mean, these figures are extremely low, and that obviously reflects the amount of effort that's being put into this. I'm happy to be shot down with the chair here, but I just wondered, looking at 3.9 and 3.11, it suggests that we do need to kind of redesign services and do things differently, and there may be some cost. Do we need to know what that is? What are we going to redesign? What are we going to do differently? How much will it cost? And what impact will it have? When will we see the improvements? And I know they're small numbers, but I just wonder if maybe as the board, we need to see a bit more detail around that with kind of timescales. I say I'm happy to be shot down if you think that's not necessary.
No, I think we should always be striving to do better, Richard. So you're very welcome to ask that question. Alison, are you the best place to respond, or one of the other officers?
I think it's a very fair question. And I think East Lothian IJB over the last 4 years have invested quite heavily in trying to solve an issue that we had 4 years ago, because 4 years ago we were hitting 70 delayed discharges. Now that's what they've got in Edinburgh at the moment. So if you think that's what we were like in East Lothian, we had 70. So we had to do something at that point because we had people stuck in all the wrong places. So the concerted effort and the work that's gone in and the investment that's gone in from this IJB has allowed us to get to that position. So I think it's absolutely right that the IJB question us as time goes on, because if you look at what's happened, there has been significant investment in hospital to home, in our social work teams, in our discharge to assess teams, and some members will remember the last year when Carers of East Lothian, no, it wasn't Carers, Vocal, no, I've got the Maureen Allen came to present us. Wiesel, I knew it was a new name, sorry, excuse me. So, and then the IJB chose to invest almost £70,000 in supporting the carers to support discharge, to assess, to support people home. So I think it's absolutely reasonable that the IJB ask us to come back and say, and we don't forget that it's the investment and in the collective work of everybody that's got us to this position from somewhere that had us on the Scottish Government watch list. If you look at percentages per 100,000. So I think we shouldn't forget. And I think that's one of the reasons when it comes to investment and other areas maybe having more of a struggle at the moment. But we're very clear, if we don't continue to invest and continue to move things forward, for example, the £900,000 that we recently got, that we've now got recurringly, we don't continue to support developments with that kind of funding, then we could easily slip back. And that's not where we want to be. And I think we absolutely should. I think it's quite right that the IJB should keep oversight of this, and we should keep challenging ourselves. I don't think we'll ever get down below 6. A previous IJB member used to always challenge me and say, well, you failed because you're not at 0. I don't think we'll ever get to 0, because we've got to discharge people safely into the right place at the right time. We don't want to be doing things just for a number. We have to remember that it's people that are at the end of this. But this money has allowed us this time to do something different, to start to think about how our providers, for example, of care at home, how they can work differently, how they can perhaps recruit staff to a geographical area, and we'll block purchase, which gives them more security as a business going into an area to try to develop services. So I think we never want to say, oh, we're doing really well, because I think the continued investment will be required to keep us at this level with our growing older people.
And I think as well the very visual integration of hospital to home and our own care at home service, seeing those two teams working closely together, and also, in terms of rural areas, that we're recognising the transport costs to get staff out to provide care in those areas. But I think it would be good, Alison, as this item will be on every IJB now through the winter, which of course extends much longer than the season does when it comes to these matters. If we could have an update on where that investment has gone and what the impact has been, I think it'd be good so that we capture all the learning from that. So, Richard, do you have any follow-up you want on that?
Just to thank you for the response, and also as a member of the Edinburgh IJB, I have always looked on with admiration and envy at your performance in this area.
I think at times maybe small is beautiful, Richard, and I'm sure the challenges are very different in Edinburgh. Now, the next person I have, I believe, is Tricia.
So we follow up with this. First of all, I like brief papers, so very well done. Like succinct messages. Few comments. Delayed discharges. Why do we need to have a target? Surely we just get as many people home safely in a timely manner. So I think that the East Lothian target of under 10 is completely satisfactory. I wouldn't wait for any other numbers. So well done on that. Two related comments is really about the GMS contract and how we're enhancing GP practice services through community additional professionals, and how we're evaluating that impact across the whole of East Lothian. So it's not just about measuring delayed discharges, it's about having appropriate care near to home. And then related to that was at 310, the single point of contact. So how is that evolving, and how does that link to the Flow Centre? And then, of course, the announcements in January. Just how is this all going to link together? So for me, this is about patient care in East Lothian, which happens to be tagged on to a delayed discharge heading.
I think you're absolutely right, Tricia, and I'm going to look to Ian because I know he's currently doing some work about the GMS, the new contract, and its impact across practices in East Lothian. So I'm going to look to Ian to maybe come in for that one.
Thanks.
Ian?
That is, thanks, Alison. That is exactly what we're trying to do now, is target some of the impact, particularly around the primary care improvement plan, of trying to put some real scrutiny under the activity that's doing by practice to begin with, but I really as an initial marker for the reflection that has on the community. The other areas, though, that we try to do practice enhancement, and I feel if I don't bring this up, I feel I need to. But the other area here I feel we do significant practice enhancement is the care home team, which is an amazing core funded development. However, you know, we've got a recent example in Musselburgh with Harbour House as a care home, which has come about additionally for us to cover and puts additional pressure on these services and additional pressure on the GP practices. So I think Trish is right, and that we've got to try and make sure that we are doing our best to make sure the services we put in place are ultimately giving benefit to the communities as a whole. But I do need to reflect that some of the decisions that are taken to put resources into communities don't reflect the impact those are then going to have on the HSCP. So sometimes we're working on the back foot to try and manage some of the pressures that are being put onto us. So I think in answer to the question, absolutely right, we will be working to bring something more cohesive to the IJB around the impacts, particularly of the primary care improvement plan and of the other work we do in primary care, like the care home team. But I think we need to ask some of our partners to really reflect on how they make their decisions on resources in communities, because ultimately we only have a fixed resource, and this just becomes harder and harder every year.
Thank you, Ian. And we want to keep people out of hospital as well, so that, you know, that requires that kind of joined up approach. Trisha, are you happy with that?
Yes, I'm happy with that. I think it's an ongoing story, and I'll welcome the feedback next year.
Yeah, and not forgetting carers in amongst all of this as well. Alison, I believe you have a final comment possibly in this item.
Just for Tricia to say that the single point of contact is something that we're working on, and Ian is also very involved. He's our rep on the scheduling of unscheduled care, and we are very mindful of the fact that some of the work could move from secondary care into primary care through the scheduling of unscheduled care. So we've definitely got that as a focus as to how that will be funded, and Claire Flanagan and her team are keeping a very close eye on that as well, because we're acutely aware that if there's a move of activity from secondary care, we'd be looking for the funding to follow it.
Thank you.
Can I follow up on that and just say, would it be possible to have a development session maybe on all of that at some point? Yep. Really understand. Thank you.
Absolutely.
Thank you. And Shameen, you've been able to join the meeting, and so thank you for letting me know that you've been delayed on other business. So you have a question or a comment, please, Shameen?
Yes, thank you. Thank you, Chair. First of all, just to commend Alison and her team for the support that you give to families to enable that individual to come out of hospital and get back into the local community. And I'm aware of the experiences that constituents have had who are able to get back home, and what a relief it is for them to be able to get home, but also they fully understand the steps that have to be in place. And you're absolutely right, Alison, about the safety comes first. So they go back home at the right time at the right place. And I just want to kind of just be reassured, and I have been, that this is realistic, and that from everything that you've said, I'm absolutely reassured that we're doing the best for those patients, enabling them to get out of hospital at home at the right time and the place. And I just want to make sure as practitioners you feel that this is realistic. This is something that's realistic, that's been placed upon us, because I know it is an area that has had some controversy around the numbers of people coming out of hospitals and then either going home or into care homes. But I just want to kind of be reassured that you feel whether this is realistic and achievable for us.
I think, yeah, thanks, Shameen. I think the additional investment helps us to do just that. It lets us put resource where we know things work. So that definitely we won't put people out. We won't put people out if we don't think they're safe. And that's it. I mean, the numbers are the numbers, and you know, I'd rather be hung for a number as be hung for somebody not being well. So we won't do that. But so all the team are very committed to being right. But the other thing I should add is we have, as Fiona mentioned, integrating the East Lothian home care team and hospital to home, and we've managed to invest in East Lothian home care team as well this year with the money, so that we can add to that. The other part of that is, if you think about discharge to assess as well, all these people that are helping are coming under one integrated care allocation process, so they're all coming together, and we're starting to look at delivering care for people who are at home as well. So we don't want it all to be about hospital discharge. We want it to be about everybody that needs care in East Lothian. So we're very slowly moving towards that, where delayed discharge is just something that we're not wanting to talk about. It's about care, and it's about care whether you're in hospital, whether you're at home, or how we access it. So we're very slowly moving towards that.
Thank you, Alison. Peter, you have a question or a comment, please?
Yeah, I don't think my hand's working, Fiona. Sorry for putting in the chat. Maybe this is off the mark, Alison, but looking at the figures for acute and mental health, I'm making an assumption that proportionally the number of delays by a percentage of mental health as compared to acute mental health is going to be a higher proportion of those patients in hospital because there's fewer of them. So does that then suggest that there's a problem or potentially something we could do more of with regard to mental health patients getting out earlier, just because of the proportionality of the numbers within the table, if that makes sense?
Yeah, and it's a good observation, Peter. People who have mental health concerns tend to take longer to get to the right place. You know, it tends to be a more bespoke package. It tends to be a specific package of care or care home place that they're waiting for. So they tend to be fewer of them, but they tend to wait longer until we get that very bespoke package sorted. We hope to address some of that, and there will be papers coming back to the IJB, hopefully early in the new year, around the top floor of Crookston Care Home, what we could potentially do for people with dementia. So we hope that we will have an internal solution for some people with dementia, but also some of the work that we will be taking forward with our housing colleagues in the East Lothian Council around Herman Flat and the development of the Herman Flat site, because the other group in there are people with learning disabilities who really, as Paul will know from his work, you know, some of the work we have to do with people and what we need to deliver for them is very complex. So I hope that there will be solutions, but these solutions aren't kind of going to happen tomorrow. But they will come back to the IJB.
Thank you, Alison. And the report we've had from Rona as well, Lukowski, on the excuse me, new project replacing Cameron cottages as well, in terms of, again, preventing admissions, is really welcome. Okay, our members of, I'm just aware of time and want to make some progress through the agenda. Are members happy to agree the recommendation at 2.1 to support this coordinated approach?
Agreed.
Thank you very much for that. Fiona, next item, please.
Thank you. Next item is item 5, which is the Adult Social Care Winter Preparedness Plan for 2020-21.
And Fiona, this is another one that I'll be speaking to. If everyone can hear me.
Yep.
Yep, great. This paper links very closely to the preceding one. It specifically, though, it describes the requirements of a new adult social care winter preparedness plan for this current year. It was published, I think it was November. It's very, very involved. It sets out a lot of requirements for the IJB and partners, but I'll give you a little bit of background. Yes, the report was published at the beginning of November 2020. It had been consulted on, though I personally wasn't aware of that consultation. It did go out to a variety of partners, including HSCPs, and it's designed really to try and interlinked with existing work on delayed discharge reductions, and it definitely chimes with the NHS Lothian winter plan and winter plans across Scotland. It also takes into account how things have been in terms of service delivery to the adult social care clients through the COVID period from March onwards, and looks at the adult social care sector at large, and it looks at the outcomes of the care home review report, all of which are referenced in the paper and can be reached by clicking on the links in the footnotes. The clients that are part of the adult social care plan are defined as those aged over 18 who as you will know, receive a wide range of care and support in home settings, in care homes and in community settings, and these services are delivered through public, independent and third sector organisation setups. It's interesting that some of the statistics delivered in the plan show how many people receive adult social care and support. 1 in 20 is estimated, that 60,000 people receive home care at any one point, that 77% of people receiving social care services are those aged 65 and over. 90% of people in care homes are aged 65 and over, not unsurprisingly, with 1 in 2 of those aged over 85. It notes that younger adults with physical and learning disabilities or mental health conditions also receive adult social care support. And it notes that poorer health and wider inequalities within any of their social care cohorts heighten the risk from COVID-19. So there's a real responsibility to improve service delivery to these groups. It notes that there are particular client groups who are particularly affected by COVID, those with dementia and their carers, people with autism and learning disabilities, and people with sensory impairment, who of course have particular needs in terms of having their communication needs met through accessible means and formats. The paper goes on to give you more statistics about the social care area, but in point 3.6, there are 4 main parts of the plan, 4 main actions. It asks that we learn from evidence to protect people who use social care support from the impact of COVID-19 and of course from wider winter viruses, norovirus and flu amongst them. It asks that we ensure that people have good physical and mental health and well-being through provision of high quality services. It asks that the social care workforce itself are supported to ensure they can deliver safe services and that they have positive health and well-being. And it asks that there's work in collaboration to plan and deliver quality care. It goes on to talk about the need for technology and digital support to allow staff to work differently within the current setting, and I guess for the best of these practices to be maintained as we begin to move on from the impacts of COVID. It notes that there's expectations that the government will work with COSLA, Care Inspectorate and others to see how the adult social care plans priorities are delivered, and there will be local oversight for this as well. 10 goes through a number of actions. I won't go through these for the adult social care workforce, for the availability of adult social care, for the delivery of transformation programmes, for carers and for primary care. At the end of the paper, there is a summary of the various actions that are underway, expected from the adult social care plan, and I'm sure colleagues can talk about those in relation to what we are doing locally for our service delivery. I'll stop there. The paper itself asks that you, I'm just trying to get to the right page.
Yeah, except 2.1 and note 2 and 3.
That's it, yes. The plan itself. Note the actions that we have underway within East Lothian, and note that we will, officers and heads of services will scrutinise the plan further and agree other actions to deliver its requirements. Thank you.
Thank you very much, Paul, for that and for the report. And Alison, I wonder if I could maybe ask you to update the IJB on funding for our winter preparedness plan. And also this kind of carries over from the previous conversation, thinking about Richard asking about what we're doing and in terms of technology, digital enablement for people. And if you can work in mentioning the latest award to the Wellwind Hub, I'll buy you a mince pie, Alison.
We'll start with that then. Okay, I'll probably, I think we're probably okay for time. I think the majority of this we touched on in the development day that we had, because that was really around the winter plan. So, I mean, really, we got the winter funding that we asked for. So we asked for it. We didn't ask for a lot of winter funding this year. It was about £350,000. And we got money to extend our hospital to home team, to put in an additional social worker for the winter period, just to put in additional hours in home care, etc. So we got our usual allocation. But then what happened was the ask of to maintain these things on an ongoing basis came from NHS Lothian, and could you prove that you could do something different? So we got the 900,000. So the two kind of merged into one. So what we have tried to do is to, as I said previously, is to invest where we knew that there was funding. There was evidence of having results, and I think it would be nice if we could think maybe a bit ahead as to what we would do differently if we didn't always have to do these papers and put these plans in with 3 days notice. But that's the reality of it, that we often get, if you get back to us in 3 days, then we'll have a discussion about giving you your money. So we're not going to turn it down. But I suppose what I would say is what we've been asked to do with this funding as well is to, if Claire was here, she would say as well, we've been asked to be a bit fleet of foot. So if something's not working, to stop doing it and try something else. So we actually do have the ability to, we've put our plan in, but if it's not working, for example, if the geographical allocation of funding to care at home providers doesn't work, we need to recognise that it's not working and change that very quickly. So we need to work out a discussion with the providers that say, well, if you're not actually providing that, then we need to get into discussion about we can't keep paying that. So it's about us starting to get into, I think, a much more dynamic conversation, and then coming back and saying, well, to the IJB or strategic planning group, that's not working, but we think we could, we don't want to give the money back, it's recurring money. So we want to always keep proving that we're using it, and we're using it innovatively. I haven't really mentioned the 2 wards in the community hospital, because at the moment the 2 wards that we've opened over and above, or are opening over and above our capacity, our 4 wards, is being funded, I suppose you could do it separately from this money. So I talk about that slightly differently, because it's almost like that's a hosted service, because we will take patients from all over Lothian into these wards if we have to at the moment. So it's almost like that's a kind of hosting arrangement. And we've certainly, I think at the moment, last week we certainly had 7 mental health patients from across Lothian in our mental health beds, because there was challenges getting them in elsewhere. So we do take people from out with East Lothian when we have capacity. So the funding of that has come really as an add-on to what our specific plans were. I don't know if I've got much more to say, apart from we were quite surprised last week or the week before to hear that Leslie Berry will tell you, she phoned me frantically at 4 o'clock one night and said, oh, we're up for an award, a national award tonight. It's on a virtual national award. And again, the Wellwind, in collaboration with Housing and East Lothian Council, won a national award for innovation in technology to enable people to stay at home. And I know that the team are looking at the moment for a second property. Second, Leslie, nod, shake your head. Second property, she's nodding, in Dunbar, so that we can have a base in Dunbar. So we're working with Housing colleagues to see how we could expand. Such a difference to be able to bring people along with their families to actually try out technology in situ and find the best thing for them. So they won another national award, which is really, really nice to see. And we would like to get something in Musselburgh as well, so that we were covering the whole of the county, so that people could come and practice. But the work the community OTs and now the integrated rehab team are putting into these services has really been quite exceptional. And it's nice. I think that's the 3rd national award they've had. So that's really, really good to hear.
Great, thank you very much, Alison, and particularly I think our thanks to Morven and Marie. And Marie Gentles retires at the end of this year.
She does indeed.
So she's made a huge contribution to that. Can I ask also, Alison, if you could say just a little bit because part of our winter preparedness will be the rollout of the COVID-19 vaccine. So I wonder if you're able just to say, I know you must be living and breathing this 24 hours a day, but I think it would be unusual if we had this meeting and didn't have some report on that. And then I'm aware, Sue and Tricia, that you're both waiting.
Okay, I will say what I can. Now, I think the other thing is we're all involved in different aspects of this. So there'll be people around, there'll have been different meetings today that'll have something different that I'm, I don't know yet. So at the moment, we will be, there will be a mass vaccination site, which will be Queen Margaret University in East Lothian. So there will be a mass vaccination site in East Lothian. And Ian is our point of contact for the strategic. What does SAG stand for, Ian? Tell me quickly.
Oh, Alison, it's a safety advisory group, but actually it would be fair to say it's a mini EPOG, which the rest of you will obviously know what that means. In effect, what it is the East Lothian subgroup looking at the implications of the mass vaccination programme on the wider partner agencies. So we had our first meeting yesterday of what we are calling a SAG plus, if you like, but a safety advisory group is something we would do, for example, for Musselburgh races to consider the full implications of that event. So we had a meeting, our first meeting yesterday with police, fire, ambulance service and council representatives to consider the implications of the mass vaccination centres on a range of different issues for our communities. So that process feeds up to a gold. So we would be the silver commanders, a feed up to a gold meeting, which is the coordination of all the Lothian local authorities working on the all partner agency implications of the vaccination as it gets rolled out. But while the NHS is very much leading on the delivery of the vaccine, we are trying to coordinate then the implications of having large vaccination centres in each of the different localities.
Yeah. So that's that was kind of what I mean about there being a lot of different facets to this. So we're all trying to, and that's again when you start to realise you're actually quite a small team, because we're all trying to cover all the different meetings. But so Ian is really taking on that lead role around the mass vaccination centre. Krista Clubb, who's an advanced nurse practitioner who works with us in our quick service. Krista has got a wealth of experience in both prescribing and immunisation. So she's come out and she's our service lead. So she's holding the overall vaccination programme for East Lothian. Gets to just about go to every meeting, lucky Krista. So we've got a role, and Diane Gray, who some of you will know, who supports Paul in the integration group. Diane's been seconded for 3 months to support Krista with the administration. So we've got a team. The elements that we're currently involved in are the staff vaccination, and by staff vaccination I mean health and social care frontline staff, I mean the vaccinators themselves, I mean GPs and practice staff, I mean care home staff. So there's a very defined group of people that we are currently able to vaccinate. Now, what I will say is we spoke previously about unpaid carers being at that first wave. That has had a step back because, and the same as some of the hospital staff have had a step back. And the reason for that is the vaccines are coming in small batches. The vaccines are coming in batches that we have to manage from week to week. The number of vaccines, in fact, at the moment, from day to day, the number of vaccines we have for the clinic. So there is a very closely monitored national rollout of where we take the vaccine. So this isn't something that we have any control or any leeway with. We very much follow the national programme as to who we may vaccinate and who we may not. And if hand up, I went on Tuesday. I'd love to have my vaccination. I didn't have it. Now, I really would like to have it, but I didn't have it because we'll wait our turn. Because there is a priority list and we have to work our way through the priority list. We hope by next week to be moving out to care homes. That is our hope, next week to move out to care homes. The logistics of getting the vaccine to the care home getting it reconstituted and delivering it in the care home are still not 100% worked out. There are many people with very bigger brains than I am who are currently trying to work that out, and it is down to of time that you can actually have between you reconstitute the vaccine, or the vaccine comes out, the -70-degree cryofreezer, of which we have one at East Lothian Community Hospital, gets taken to a site, and it's got 5 days where it can unreconstituted survive for 2 to 8 degrees, so in another fridge, and then it's got 6 hours after reconstitution to delivery. So that there's a whole chain of things once we actually take delivery into NHS Lothian about the logistics of getting that rolled out. When we go out to care homes, we've got the logistics of that it has to be a member of NHS Lothian staff who receives that, and that's because of the regulations about the drug itself. So it has to be somebody from NHS Lothian. So you can't take a load out and leave them, and then you go and vaccinate people. That's not allowed under the regulations. So it has to be a member of it, the person who's going to vaccinate, that takes possession of them. So there's a huge logistical challenge behind moving this out. We have, though, our clinics are going, we've had enough vaccine to vaccinate. Krista's got the clinic set up at the community hospital, and people are starting to move through. So there is positivity. The vaccine's not coming as quickly as we had hoped, but it is coming. And then we are hopeful that the next vaccine starts coming as well. And you know, there will come a point where we'll have more than one vaccine, and this will be rolling. But we're ready to go, and we're ready to have the mass vaccine centre set up from January, February, vaccine permitting, and we anticipate that East Lothian Community Hospital will continue to vaccinate over the course of the next year, so that we would have potentially another site for people to come to. But it's again down to the logistics of how we manage this vaccine and others. We have also heard today that there's a CMO letter, Chief Medical Officer letter, come out today that following the anaphylactoid reactions of the 2 members of staff, that they are building in a 15-minute wait and observation after each injection. Now that again will cause us scheduling issues, because we will have to ask people to wait for, and that's new today, for 15 minutes. After the
shows you how much this is changing. And thank you so much, Alison, for just helping us to understand the complexity of this. And of course, you know, 21 days from now, the people who've had the first dose are going to need their second dose, and you don't have a second, presumably, you know, battalion of people. Oh, you do? That's good, because I did think, gosh, what happens when you hit that? But I don't want us to have too many questions on this, because we do have other business, but I just thought it was really important to have some of that in record. So thank you for that, and Ian, for all your efforts. Okay, I've got Sue, who's been waiting for a question or a comment.
Yes, I think actually to some extent Alison's answer on the vaccine may sort of make my question invalid, but I also wanted to congratulate the teams for their awards. And it's wonderful news, and it should be broadcast widely, I think.
Yeah, absolutely.
My question was about the testing and whether we had a big availability of testing, because in one of the appendices it says that all care home staff are offered the testing, whereas surely it would be better if it was sort of, if you like, compulsory, so that we could pick up people before they were able to infect other people. I just sort of wondered whether or not we had enough testing capacity to really sort of nail the people before they start spreading it around, basically, was my question.
We have been testing in care homes for about 3 months, so there are weekly tests done in all the care homes. It's not mandatory, but the majority of people in our care homes in East Lothian are taking the test. We've got a very high return on care home tests, and from next week they will be rolling out testing of visitors in care homes. That's just been next week. So there's been some pilot areas where I think 14 pilot areas that they've been piloting the testing of relatives, and we've had discussion today and about supporting the care homes in East Lothian to support their carers, relatives, to take the test. It's not mandatory in the same way as the vaccine won't be mandatory, but the majority of care home staff in East Lothian are undertaking the COVID testing on a weekly basis.
Ian, you wanted to supplement
Thanks
that?
very much.
It was really just to reiterate on Alison's comment. Although it's not mandatory, she covered it in the end. The care homes are being very responsive and actually filling this in. I think the issue for most of them is actually just the length of time it takes to physically do the paperwork generated by the test and then submit it and then collate the results. But really, they've been working exceptionally well with us to ensure that they're safe and they're operating as safely as they can.
That's super news. Thank you so much for that reassurance. Thank you.
Thank you, Sue, and thank you, Ian and Alison. I'm just looking to see if I have any other hands raised. Tricia.
Just a big congratulations on all the hard work. So my two questions are very anecdotal and could be taken up another time. But one was to follow up on the test of change in Dunbar, which was quite interesting. A comment was about mental health has moved online. So I just wondered how much support for patients they would have to be able to get the best out of online. Is there a sort of a facilitation, navigation, support for mental illness?
Yeah, I think perhaps that is something I'll need to come back to you on, Tricia, mainly because I know it's not completely online, the booking's online, and then there's interactions with the team. So I would need to get I'd maybe ask Melissa to come back and speak to us about that, but happy to do that. And I don't have an update as yet on the Dunbar project. I don't know if any of the officers on the line will have, but we can certainly bring that back.
Laura, are you still, Laura's with us. Would you be able, Laura, because things have in terms.
And in fact, Fiona, you may do it better than I. I think certainly, as far as I know, the Dunbar pilot has been successful. I know the officers involved in that will provide a comprehensive kind of report, and certainly the work that's going on there is influencing how we develop other centres along with the centres. It's been I think this is the right thing to say. It's been a really positive experience. Fiona, come in if you don't feel, but I think it's highlighted different ways we want to sort of commission services. It's how we can link better our community services with our paid services or our care at home services to improve capacity. So no, we don't have a written report yet, and it's not quite time for that. It probably will be. We certainly would be more than happy to come kind of in January to give further update on the day centres and Dunbar pilot.
Yeah, and I can maybe just, in case anyone's wondering what the test of change, that was about people who were using our day services for old, well, not our services, third sector, they're all independent charities, our 9 day centres for older people, and 3 of those are now looking at partial opening. So there'll be an assessment of who needs to actually, particularly looking at respite for carers. So there are 3 that are well underway for partial reopening. So the ground has almost kind of shifted in a way, given that we now get a vaccine, though, those are staff may be waiting a little while and the service users before they have them. But as ever with these things, Tricia, the ground keeps shifting, but the team are being, and our partners in providing the services are being really flexible in responding to how those changes are happening. I'll maybe get certainly North Berwick Day Centre has a newsletter. All the others, if you try and follow them on social media, you'll see lots of the work that they're doing to continue to support people and tackle in particular social isolation and provide support with care to the carers. So I hope that provides some, but we can, I expect, reflect on this in the new year and get an update then if you're happy with that, Tricia.
Yes, thank you very much.
Okay, are there any other questions or comments for this report? No, thank you very much for all the contributions. So are members happy to accept the recommendation at 2.1 and note the recommendations at 2 and 3, please?
Happy to support. Happy to support.
Thank you very much for that. Okay, we're now moving to the final item, and David, I'm aware that you will now need to leave because you've declared an interest in this item. So just for your contribution and for agreeing to stick with us, and I'll get back to you to let you know just how long your your contribution is going to be, David, and to wish you well over the festive period. Right. Okay, Fiona, that's David leaving. So would you now like to bring us to the final item on the agenda?
Okay, thank you. The last item is item 7, which is the reappointment of a non-voting member of the IJB. And do you want me to summarise the report, Chair, or do you want to? Okay. The report is asking the IJB to agree to the reappointment of David Binney as a non-voting member representing carers. And in the background, you'll see that he was originally appointed back in September 2018 for a 2-year period. And unfortunately, due to various things, we haven't got round to reappointing him until this point, but his reappointment would take effect from September of this year rather than December. So it would be, the proposal is for 2 years from September of this year.
And David has raised with me that there's an inequality here in that the third sector, and this is going to impact on you, Paul, as well, and the third sector representative and the carer representative to the IJB only sit for 2 years, and kind of question why that was. And there doesn't seem to be any reason that I can think of why we would not have them sitting for 3 years, and we can still stagger those. So I'm going to put forward an amendment to this report, which would be that David's reappointment is for a period of a further 3 years, and Fiona will need a seconder for that, and then that we bring a report to the next meeting which deals with the issue of the carer representative. But if anyone has any questions or comments they want to make, if I could also have someone second that recommendation, that would be really helpful. Thank you.
I'm happy to second that, Chair.
Thank you, Shameen. Are there any questions or comments? No, that's great. Okay, and Paul, we'll look forward to having you around for longer, I hope. So Fiona, for this item, I think we will, if we could have a roll call vote for this one, just as we're actually agreeing a change here. So if you could progress that, please. Thank you.
Thank you. Just to summarise for members that the proposal is to amend the recommendation in the report, and that the IJB agree to reappoint David Binney as a non-voting member to represent carers for a further period of 3 years. And I'll go to each voting member individually, and if you could please just indicate your voting intention. I'll start with Shameen Akhtar.
Agree.
Thank you. Neil Gilbert. Is Neil still with us?
No.
No. Okay. Sue Kempson.
Agree.
Patricia Donald.
Agree.
Fiona Ireland.
Agree.
Thank you. Peter Murray.
Agree.
Richard Williams.
Agreed.
And Fiona O'Donnell.
Agreed.
Thank you. That's the recommendation has been approved unanimously. And that concludes the business for today, Chair.
Thank you very much. And just to remind members, if you could stay with us for 10 seconds, and mute yourself at that point while the recording ends. Can I just say a huge thank you to all of you, especially our new members. I think are making a really great contribution to the IJB. It feels that we're having appropriate challenge and scrutiny, and I really welcome everyone's contributions. And I wish you all the best over the festive period, and look forward to working with you all for at least part of 2021. And stay well, and your families and loved ones too.
Thank you, Fiona.